Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, a lot of people with cancer are interested in trying almost anything that may help them, including complementary, alternative, or non-traditional treatments. But the question is, what's legitimate, what's reasonable and might help, and what's bogus or not legitimate?
Here to help us sort out the good from the bad is the Director of Research for the Mayo Clinic Integrative Medicine Program and Medical Director of the Well Living Lab, Dr. Brent Bauer. Welcome back to the program, Dr. Bauer.
Great to be back.
Thank you. Nice to see you. I kind of like this, the Well Living Lab. Have you got any spots open there?
We always have room for you.
What is that?
So it's a place where we actually can monitor the environment and see the impact of the indoor environment on human health. So how much light comes into your eyes, what the air quality might be doing, what does it do for productivity, and more importantly, how do we improve those to enhance your health and wellness?
And what's the most important thing you've learned from the Living Lab so far?
You know, I think it's everything. I think you have to have a balance of nutrition, exercise, but also then optimize the indoor environment.
What should the temperature of the office be?
Well, that's a loaded question.
Are you ready to give an edict?
Yeah, I don't think so. I think that's an ongoing discussion.
There are offices all around this country that need to know the answer to that question.
Yes.
All right, the topic at hand. So there is a role for alternative treatments for patients with cancer?
Well, I think that's kind of the terminology that we probably used 20 years ago, alternative medicine or alternative therapies.
So we're only 20 years behind the time.
I didn't say it.
Well, no, but I think it's an important point because people still use that term. But in fact, most studies show that patients really aren't using alternatives. They're not going outside and doing something entirely different from conventional. They're taking conventional medicine, the best we have to offer, but then they're adding other things like acupuncture, massage, meditation, and herbs. And what we've now learned is there's a lot of evidence that some of those things can actually be helpful as part of an overall approach.
So testing or research is the difference?
Well, I think if we go back 20 years ago, there wasn't that much data. Now we have tons of studies, many of them done here at Mayo, that actually can help us sift the wheat from the chaff. A lot of chaff out there, but there's some wheat, and we shouldn't throw away the baby with the bathwater.
What are some of the new things that have been sifted out?
Well, I think if you look at specific problems like pain, a lot of patients dealing with cancer have pain as part of the treatment or even with the cancer itself. Acupuncture has been shown in a number of studies to be very helpful for many patients. Mind-body practices, meditation, yoga, tai chi, help with all kinds of anxiety, stressful parts of the treatment, parts of the cancer. So those types of things we can pretty readily integrate, and that gives us this newer concept of integrative medicine, taking the best of both worlds, but making sure it's evidence-based before we bring it into our regular practice.
So alternative complementary is sort of passé, and now we call it integrative medicine.
Yeah, even the NIH, which used to have a center called the National Center for Complementary and Alternative Medicine, has dropped the alternative term and is using integrative. So I think integrative is really a better reflection of what research for the past 20 years has brought us to. It's a new point where we should be able to say, does this work as part of an overall approach? And if it does, then we ought to offer it if it's helping our patients.
Let's talk about some of the things that the research has shown that you listed that is working for patients. So you said acupuncture for pain. Are there other reasons patients might want to try acupuncture?
I just have one more question on acupuncture. What's the science behind that? And I think you've actually tried this, right,
Oh, yeah.
Tracy?
Yes.
So what's the science behind acupuncture? How do you know where to put the needle? Does it hurt? Are there good acupuncturists and not so good acupuncturists? And
Yes,
read
the book, yes
here.
and no. Yeah, so it's a great question. I mean, acupuncture has been around for, probably 3,000 years, depending on how you look at some of the history from China. What's really changed in the last 20 years is the number of studies that have been done with, I think, a good marriage of science and Eastern, if you want to think of it that way. In other words, we had a lot of older studies where perhaps an acupuncturist did a study, maybe the science wasn't great. Then we had a lot of scientists doing studies where they didn't participate or collaborate with the acupuncturist. That wasn't so great. Now we actually have a lot of studies where we can work with our acupuncture colleagues, have them help us design the studies in a way that still honors the practice, but we can be very satisfied with the rigor of the research findings. And I think that's what's changed.
And no, it does not hurt.
Okay, but I still don't understand it. I mean, if you got a book there that Tracy comes in with shoulder pain and you go to page 250 and said, put the needle there.
Not quite. Yeah.
What's,
So,
I
so
don't
very
get it.
very different approach. So if I come to you with a shoulder problem, you're probably going to follow a fairly similar approach to the next person you see with that type of shoulder pain. From an Eastern perspective, they're going to look at much different other things going on, the tongue, the pulse, things that we don't really think of as an integral part of our diagnostic efforts. They're going to put all that together and come up with a very different approach, not just where the needles go, but probably different dietary recommendations, maybe different exercise recommendations. So for us, we approach things as sort of the diagnosis is X and we treat it this way. For them, the diagnosis is X, Y, Z. It's going to be very different for each individual.
And how do you learn to become an acupuncturist?
Well, there's a number of colleges now. We've hired a number of colleagues from one of the universities up in the Twin Cities, where you can have a 3 to 4 year program in learning acupuncture and also other elements of traditional Chinese medicine. So a lot of them are trained in things like Qigong, different types of massage like Tui Na, and even the herbs, how to use traditional Chinese medicine herbs.
All right, let's go back to my question. So you use acupuncture for pain. Are there any other indications?
So we see a lot of patients benefit from acupuncture used for nausea. A lot of the chemotherapy regimens can cause nausea. Treating with acupuncture, very helpful.
Any others?
You know, we see a lot of people use acupuncture for a lot of different things: sleep, headaches, migraine, preventing migraines. I think there's a lot of studies out there for pain. There's a lot of studies out there for nausea. I think those are well accepted indications. Then there's a lot of other things which are much more individual, and I'm very willing to try it with a patient if we don't have a better solution from a conventional standpoint.
They also help middle-aged runners.
Yeah.
That's all.
I'm
Sometimes
interested.
that hip gets all out of whack, and acupuncture seems to do the trick.
So I go to the orthopedic surgeon.
No way.
I
Let's talk
understand.
about aromatherapy.
So again, if you think about what's going on when you're being treated for a difficult diagnosis like cancer, there's a lot of stress. Stress from the diagnosis, stress from the treatment, stress just from having your life upended. We know that stress does a lot of negative things. It suppresses immune function. It can slow wound healing. Those are two things we don't want to have happen while we're trying to treat somebody with cancer. So anything we can bring to the table that helps people relax can have a big impact, not to cure the cancer, but to be part of the overall approach. And aromatherapy falls in that category. Many people find it very relaxing. Some people find it invigorating. There's different aromas that can be used to improve your mood, help you relax, maybe sleep better with lavender or chamomile. So I think there's a role for it. It's not going to cure cancer. We're not looking for it to do that. We're asking it, can it be part of the overall approach to help the patient feel better?
I like that things that when we're talking about to help benefit cancer patients, you've got acupuncture, aromatherapy, and the third on that list that we've got is exercise.
Yes. Well, I think anytime somebody comes to us in the integrative medicine program and says, I want to take an herb or I want to do acupuncture, our first question is, did you build your foundation? And the foundation is always, what are you doing for nutrition? What are you doing for exercise? What's your mind-body approach? What's your social support? How's your sleep? And what's your spirituality? If we can build those 7 things as a foundation, then adding things like the acupuncture and herbs and so forth can play a role. But the foundation is still going to be what I would consider very basic wellness that most physicians would understand. That's where we should start.
All right, what about hypnosis?
So we do hypnosis here at Mayo Clinic. We have, I think, good success with it. Again, it's not for everybody. People seem to have different degrees of how susceptible they are. But for most patients, we can achieve a lot of reduction in stress, sometimes with pain. Of course, there's a number of older studies where people tried to use it for smoking cessation, weight loss, and so forth. Not a lot of studies, but again, some anecdotal patient stories that were very helpful.
And do you have hypnotists? They're specially trained people.
We have a couple physicians and one licensed practitioner who is available to do hypnotherapy.
Are you one of them?
No, I am not.
You can't hypnotize Tracy before we break?
No.
Our guest is the Director of Research for the Integrative Medicine Program at the Mayo Clinic and also the Director of the Well Living Lab. Time for a short break. When we come back, we'll talk about more modalities that may be of help to patients who have been diagnosed with cancer. Plus, we'll talk about some questionable, some bogus, some even fraudulent products. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Our guest is the Director of Research for the Integrative Medicine Program, used to be called Alternative and Complementary Medicine, Dr. Brent Bauer. All right, Dr. Bauer, we've got more modalities we want to ask you about.
Sure.
The 3 M's: massage, music, and meditation.
So massage is easy, right? I mean, I think if you've ever had a massage and you enjoyed it, you can see where the benefit is. Not everybody likes massage, but for people who are kind of wired for massage, the studies are really pretty much inescapable. Can reduce pain, can reduce tension, can reduce anxiety. So we love massage in terms of another modality, not to cure cancer, but to help the patient deal with the overall milieu of treating cancer, recovering from cancer, and going on to have health.
And who wouldn't want a massage, right?
I don't know. Again, middle-aged
Cancer or
running.
not, yeah.
Let's talk about music therapy. That kind of, for me anyway, comes into the aromatherapy avenue, that is just stuff that helps relieve stress.
Absolutely. So I think a quick distinction, music therapy involves a music therapist. So there are people who are trained to be part of the clinical team. They come in, they have goals, they assess the patient, and they use music very targeted. So they might play an instrument with the patient, they may sing, they may do different things. And then there's also what I think is more commonly thought of, just music. Do we play music in the operating room? Many physicians do. Do we listen to music while we're recovering? Do we listen to music in the hospital room? We did a small trial with Chip Davis from Mannheim Steamroller many years ago, just playing nature sounds in the room in the post-operative setting for patients who had open heart surgery, lowered pain, lowered anxiety. So I think we're sort of wired for nature, we're sort of wired for music, and if you like it and we can incorporate it in whatever setting and whatever choice you choose, why not?
Meditation you can do on your own or with an instructor.
Definitely love the whole mind-body realm. Meditation's probably the most familiar. Not every patient can meditate, in the classical sense, but we can usually find something of a mind-body practice. So if they don't like meditation, we'll try Tai Chi, we'll try yoga, we'll try a whole lot of different things. There's a lot of biofeedback devices on the market now that can actually measure heart rate variability, your EEG, your brain waves, and help you learn exactly how to get the brain into that setting.
There's lots of meditation prompts or podcasts or that you can find online as well.
I think the critical thing is we're all unique. So what works for you may not work for me, may not work for the next person. So I'm never very prescriptive. I always try and give people a lot of choices and then permission to play. Try yoga, try Tai Chi. You find the one you like, that's for you.
Before we move on to the bogus claims, I just have to say yoga seems to have gone much more mainstream. I know the classes that I go to, there are so many retired people, so many more men. It's just really seemed to broaden out the people that are turning to yoga.
Yeah. And I think for the same reason, acupuncture is sort of following that same pathway. As the research gets stronger and stronger, as more and more quality studies are done, yoga just keeps coming back and showing it can almost, in every study, comes back and shows reduction in stress, usually reduction in pain, and then a lot of other health benefits that just kind of say, well, why not try it? And again, I have patients who can't do it, who don't like it, and I don't push them. But if they try it, they don't like it, try something else. But if they do, it can be a great accompaniment to the rest of their wellness program.
If you want to try yoga, is it best to go find a yoga instructor and go to a class, or can you potentially learn yoga from a podcast or a video?
We do a little bit of both. We have Mayo, our patient education folks have done a great job. There's some really nice CDs and DVDs we can give patients, and they're very simple moves. Go home and try this little bit of Tai Chi, try this little bit of yoga. That sometimes is enough to say, nope, that's not for me. Okay, then find something else. If you kind of like it, then definitely find a good course with a good instructor who will work with you at the level you're at, not push you too fast.
All right, we have to talk about the bogus, questionable treatments. And at the top of my list, CBD is absolutely everywhere today. And what sort of research has been done on that so far?
Well, and I wouldn't start out, it's probably not in the bogus category, it's in the be further differentiated category. So CBD oil or CBD is one of the components of marijuana. So the marijuana plant, the cannabis sativa, can produce either the form that has a lot of THC, that would be the typical marijuana, let's get high. And then there's also hemp, which is the same plant species, but just cultivated not to have THC. So you can harvest CBD from either one, but it gets very dicey with the legal structure if you're taking it from the plant that has a lot of THC. But CBD by itself, along with several other cannabidiol-like components, actually seem to have some anti-inflammatory effects and, for many patients, anti-anxiety effects. Now, the trouble is we don't have good long-term studies.
That's what I want to know.
Of 500 people who took it, and we watched them for 2 years, and then we know the side. So it's very intriguing. There is animal data and very, very tiny human data to suggest we're onto something. But like everything that's ever come down the pike before, it will not be the single silver bullet answer all questions, but it's probably going to find a role to be very helpful for select patients when used properly.
Do you think it'll be legalized?
Well, CBD is legal if you don't sell it as
in
CBD.
states.
Yeah,
Certain states.
Yep.
Not everywhere. Right?
Yep. If you how you advertise it and how you promote it, it puts you in trouble with the FTC. But with the new legislation on hemp and hemp farming, CBD seems to be okay, at least from a consumer perspective. If you're selling it, you may have some other challenges.
All right, let's talk about vitamins and supplements, because there are a lot of claims out there that some of these are anti-cancer or have an anti-cancer effect. So I'd like your opinion. Let's start with vitamin D.
So it's another one of those great vitamin stories where if you would asked us 20 years ago, what do we care about vitamin D? Most physicians said, not much. It's probably important for bones. Now, if we look in the last 20 years, tons of studies suggest that vitamin D plays a role, not just in bone health, but brain health, muscle health. And now we have studies that show vitamin D deficiency in older people can actually cause them to fall more often because of effects on the muscles. So it kind of went from something only the wacky folks were talking about to now it's one of the most common blood laboratory tests done here at Mayo Clinic.
Is it a routine laboratory test now?
I don't think it's routine, but I think and I don't do it for every patient, but if I have a patient who falls in the category of more likely to be vitamin D deficient, and that tends to be people who are older, people with darker skin, so we see a real lot of vitamin D deficiency in our patients who come from the Middle East. Darker skin and oftentimes covering the skin totally, we see almost an epidemic of vitamin D deficiency.
Because they're not getting vitamin D from the sun.
From the sun.
All right, what about green tea?
Green tea is probably one of those things that falls in the category, do it for your health, have a cup or two per day. Taking supplements where they've tried to extract the magic portions, probably not so helpful.
What are the things that have been proven to not help people?
Yeah, unfortunately, that's...
There's a long list.
Do we have 2 hours? Yeah, exactly. I think, obviously some of the things that have kind of had their day in the sun, shark cartilage was one study.
Shark cartilage enema, that was even
Oh, yeah. Well,
better.
and the coffee enemas are still out there. There's still many places in, not necessarily the United States so easily, but certainly go across the border and you can get all kinds of coffee enemas and so forth, things that have real danger. You can go to the couple clinics in Germany where you can get ozone injected in your bloodstream. I mean, there's a lot of things that desperate people, especially if you've been to a place like Mayo and you're at a point where we don't have a lot to offer you, then you can see why people would be interested in, I got to try something. But really to help them not spend their time and resources doing things that we know can help and could be harmful, I think that's equally as important as helping them make good decisions about other things that can be helpful and improve their quality of life.
All right, what about cupping?
So cupping's kind of a cousin to acupuncture, same kind of concept. You're basically trying to manipulate this flow of energy, right? So the acupuncture needles are kind of hitting these points where the energy flows. The cupping's sort of the same concept. Fewer studies, but kind of in that same ballpark. Seems like there's probably something there, but we don't have really deep studies yet.
And Laetrile, because there used to be a fair number of patients who would go from here down to Mexico to get Laetrile. I think it was peach seeds, wasn't it?
Yep. Yeah, so Laetrile has a lot of interesting studies in test tubes, and then in humans never really worked. A number of studies were done. They've all been negative. I don't think there's any reason to be going after Laetrile any further at this point.
All right, and some herbs, curcumin and echinacea, for example?
Yeah, so echinacea was like one of the top selling herbs 10 years ago. Now it's kind of dropped off, mostly because studies showed it doesn't seem to have as much impact on fighting colds and flu as it once was thought to do. So that's where research is actually changing behavior. I think that's good. Curcumin, on the other hand, I think is still in that undifferentiated category. Preclinical, so test tube and animal studies, does have some anti-cancer activity, and it's pretty good in terms of anti-inflammatory effects. So it's plausible it could have a role. But again, we don't have the large clinical trials, so it's premature to say I'm going to take it as part of my cancer treatment, because like many herbs, it can interfere with many of the chemotherapy agents we use. So it's not a free-for-all where I've heard something on the radio or I saw something on a TV show, I'm going to start taking it. You always have to have that first step of go back and talk to your clinical team. I'm thinking about X. Does this interfere with my chemo? Does it interfere with my cancer? Does it interfere with my other medications? And is there enough evidence that we could agree that I should try it? And I think if we have that conversation, we can keep ourselves out of a lot of trouble.
All right, one last one, magnets.
Well, they're fun to play with on the fridge. There's a few small studies that suggest maybe it can help with some muscle pain here and there. Nothing that would suggest it could help cancer.
All right. Well, I think that the key here is it's called integrative medicine now, and do what your traditional, your regular, your oncologist doctor tells you to do when it comes to treating your cancer. But also, it's reasonable to integrate some of these other modalities at the same time.
Absolutely.
Of course, our sympathies to anybody who has been diagnosed with cancer, but there are lots of things out there to help them. Dr. Brent Bauer, thanks so much for being with us.
Always a pleasure.